So to come here in the mornings, I have to encourage myself, and even sometimes I have to talk to my colleagues to encourage me to come here, because really the matter of the fact is that there's too many patients here for one nurse to deal with. It's very hard to pull myself out of the bed to deal with patients who need oxygen. When I call for oxygen, there's no oxygen in the hospital. Patients are distressed. What can I do if there's no oxygen here? It's very disappointing and discouraging. It's very sad to know that I'm a nurse and I can't help them when they need oxygen because of the COVID spike. What I always wanted to say if I got the chance, and I got the chance now, is that COVID is real. Please social distance, wash your hands and stay home. Too many elderly patients are coming here needing oxygen, COVID positive. Couple days later after they're admitted, they die. It's very sad.
You say you call, sometimes your colleagues, you have to talk to them to make you come, to encourage you to come to work. What did they say to you?
Okay, so basically they're saying that, oh, I'll be at work today, so don't worry, you know, we kind of lean on each other's shoulder. And I even have a colleague right now who is very depressed because we have a next area that's called the respiratory area. If you go out there now, we have one specific area for them that doesn't even have a bathroom for them to shower. And then because there are so many respiratory patients, they're in the waiting area. The waiting area is not for patients who are hospitalized. It is for patients who need treatment to go home. But no, there's bed. So we don't have enough space for that, and to come here to see that is very discouraging. But then at the same time, you have to be like, oh no, if I don't come, the place is short. I have to go to help my colleagues. That's the only thing holding me here right now, helping my colleagues, because I know that once I'm at work, we'll work together to go through this. But it's very hard on our body, on our soul and mind to be working so hard every day. If we come to work 3 times for the week or even 4 times, it's always going to be like this. Nothing changed. I was off for the weekend thinking that something would have been different. But when I came this morning, I saw more beds outside in the waiting area. I was like, no, this can't work, people. This can't work. I am human. I can't do so much.
You ever have a day where you say, boy, I can't take it, I don't want to go to work today?
Well, actually every day. Because knowing what you're coming into, but you still have to come, the feelings is there that you don't want to come.
So how you get yourself up and into the work?
I just tell myself that I'm already in the health system, so I have to go and help who need help.
You ever feel like quitting?
No, I've never felt that way, but at times I feel like I can't make it today, but I still push out to be here.
You ever feel like quitting?
Definitely. I was even speaking to a colleague and she's like, only thing is left for me to do is quit. She didn't even message us to say she wasn't coming to work other day because she was so frustrated. And I was like, I understand, but it's either you come and we just deal with it, or it's up to you if you want to leave, because your mental health comes first.
In the red zone, what it means is that we are over capacity in the number of patients that are turning up with respiratory illnesses, right? So we are at 205-bed hospital, and there are times when we are over 300. Our respiratory cases far exceed the number of beds that we have for isolation. So we started out at 18 beds, and when you're at 97 patients in an institution with 18 beds, it means that you have to activate your surge plan. So when you get to that point, it means that you are in the red zone.
So where are all the patients? Where are you putting the other patients?
So for the patients that turn up with NCDs, we try
non-communicable diseases.
Non-communicable diseases, we have to treat them at another area, right? The other patients that are not emergencies, we redirect them to the health centers. But what we have been seeing now is a great increase in the number of persons that are turning up. So you have patients sitting in the emergency room for 4 days, sitting on a regular chair. There are those who are in the chair, wheelchairs. And so I'm not certain if the porters said it to you, but this is one of the things that's hampering their efforts. There's not enough wheelchairs to go around because patients are actually sitting in them, waiting for a bed.
How does this wave compare to the last COVID wave that you had? Is this much worse, and if so, how?
It's much worse. How? Because there's more people coming in.
This is worse. Initially, when we started preparation for COVID, we had small numbers, 15, 13, 12. Now we are in the 90s and hundreds and so forth.
We got a